naps can be a good thing. In fact, historically, naps were totally normal. The fact that we don't sort of take for granted that we should all be taking a nap in this particular place, in this Western culture, is really quite modern. It's an artifact of industrialization and wanting people to work from 9 to 5. And that has spread across the world so that we see that this culture of taking a nap or a siesta, whatever you like, that used to be very pervasive, and it's dying out as globalization spreads. What that means is that there's lots of reasons why taking a nap shouldn't be something that worries you. And I certainly don't want to leave you with the impression that if you took a nap, that's bad. That's not the case. Naps can be great. In fact, naps refresh you. Naps can help you consolidate your memories and your emotions so that you can actually be as alert after a half-hour nap as you are when you wake up in the morning, if it's a good nap, if it's a well-timed nap. The problem arises when these naps are not good naps. So naps can also be a risk sign. And this is contrasting this image here. This person isn't resting in a hammock. They didn't say, yeah, it's time for my siesta. I'm going to go lay out in the sun, feel happy. They were trying to do something. They were reading, they were trying to work, but they just didn't get a good night's sleep. They have this sleep pressure built up inside them. And as a result, uncontrollably, they're falling asleep during the day. And this is a sort of a sign which, if we see it over time, tells us that there's something bad happening, that this person's body is not keeping up, and we should worry about their health. We might want to think about an intervention to try to help them get back on track. If they can recover their sleep, they might do very well. But if this continues, this could definitely be a risk sign for the development of things like Alzheimer's and related dementias down the line. So the data story I want to tell you today is about naps. It's about this idea that we could use temperature from wearable devices to look at how naps and sleep happen during the day with a resolution that's never been seen before. But more importantly than that, that resolution lets us follow people across time so that you can conceive of not just on average, is napping good or bad, which is hard to tell, any individual nap, was that a good nap or a bad nap? It's hard to know. Rather, can you follow yourself across time by using these technologies so that we can imagine developing screens for the emergence of sleep disruption as a risk factor very early on before things like dementias develop. So let's get into some data here. Right now, what we're looking at is distal temperature, so skin temperature, as opposed to core temperature. And just as I warned you, we see that it's the opposite of what we saw. So we have sleep, where it's very, very warm. Again, this is your skin dumping all of that heat from your core to help your core cool down. That makes your skin hotter. And then we have wake along here. Here I'm cartooning it in noon, but you can see this waterfall at the left edge is really people waking up. People are then awake into the day, and that temperature goes back up as they fall asleep in the evening. Now, of course, what you might notice is that it's not just a flat line. It's not a perfect sine wave, nor is it just a light switch on and off. But there's sort of waves to it. Specifically, there's this wave we see around 1400, 1600, so 2 to 4 in the afternoon, which we hypothesize might be an indication of sleep. And I'll show you that that seems to be the case. Before we go there, though, we also see that there's this stripiness. You might wonder what that is. This is different decades of life, averaged across people that were extracted and analyzed from this very large COVID study that we did. The study involved tens of thousands of volunteers. And so while this is not COVID itself, it helps us understand the physiology that makes people different from each other so that we can make better algorithms like COVID, like Alzheimer's detection, like sleep disruption detection across these very diverse populations of people. So here the lens on diversity we're using is age, and we're seeing that as people get older, we're coloring those lines darker purple in this case, they're getting warmer and warmer during the day. Not all of that may be related to sleep. It's also the case that as people age, they tend to lose a little bit of control of their capillaries, the vascular muscles that keep your blood vessels tight. These tend to wear out a little bit over time. And so we expect that people feel a little colder as they get older, and that this also registers in our wearable devices as more loss of heat through the skin. So we see that loss of heat as heat being picked up by these wearable devices, so warming in this case. Person feels cold because they're losing heat. The device picks up that lost heat, so the device thinks it's hotter. So we can think about already, how is this different than what we knew in the past? Well, in the past, we would have taken our temperature with a thermometer. This is a Kinsa thermometer. These were one of the smart thermometers that was deployed early in the COVID pandemic to great effect. They figured out that even though this is just taking your temperature once a day, this was sold to women tracking their cycle and seeing when they get hot and knowing that they've ovulated. But people had this thermometer. They were taking their temperature every day. And Kinsa said, hey, that's cool. While there's this pandemic happening and people are getting inflammation and fevers, maybe we can just look at where are those temperatures hotter than they should be on average, county by county, and we can create a daily risk map. And they actually did this, and this was useful for researchers. This was useful for the CDC. We had a lot of people around the country saying, it looks like I'm getting hotter today, and Kinsa could say, oh, it looks like lots of people in your area are getting hotter today. That's not good. Maybe more people are getting sick. The problem, though, is that if that's only one measurement a day, we don't see these beautiful shapes. We don't see these beautiful waves. We don't know where we are in those. We only have the one number. And so we can't really see these subtle changes across the day in the same way. By contrast, once again, by using a wearable device, here picture the Oura Ring so you can see some little sensors inside it. It's small, it's worn, it's a thing people tend to put on and then forget about. And it therefore is able to generate temperature measurements every minute, all of the time, every day, continuously. And so again, as this kind of technology becomes more available, we can expect not to say on average what is somebody's temperature at some time during the day, but specifically, what are these shapes across the day, across days, and how is that changing? So if we focus on the two extremes in this line, if we look at naps, first let's talk about knowing this is really sleep. If we look at when are all of these different groups more likely to sleep during the day, so we're excluding nighttime sleep, we're just looking at islands of sleep during the day here, we see that there's this large rise in propensity to sleep right at when that temperature bubble is happening, right when that little wave is going up. So this really lines up with our expectation. We see this rise of temperature in the afternoon. It correlates very well with napping. We already know from the scientific literature that when people sleep, they show these temperature changes. So this gives us good confidence that, in fact, these temperature changes are indicating something like sleep pressure. So if we go back and we focus on the two extremes in this group, the youngest and the oldest, we can start to imagine a story of tracking somebody where we say, okay, on average, people above 70 look more like this pink line on any given day. On average, people who are in their 20s or 30s look more like this light blue line every day. But people are very different from each other. People have different behavioral patterns. People have different health conditions. It's really not reasonable to say everybody should look like one of these. Instead, what we might want to say is, could we follow people across their health journeys and try to figure out, are they looking more or less like one of these as they age? Remember, the first wearable devices that were commercially viable, that were really a big deal, didn't emerge until around 2013, 2014. So we've only lived with technologies like this for about 10 years, and many of those years without wide adoption. But we can expect to look to a future where they become much more common, they become integrated into our lives, they become cheaper, more people gain access. And so we can imagine saying, okay, well, I've only got a few days, months, years of my own data, but I can expect to see more data from myself as I age in this new tech-enabled world. Am I looking more pink as I age? Am I staying blue? Let's cartoon that out with a little bit more clarity. So we'll move this over to the side a little bit. We're not worrying about the axes or the specific numbers. We're worrying about the similarity of the shapes. When one starts to build a health algorithm, you're trying to get what I affectionately refer to as the robot, but some computer algorithm, some computer series of steps, to look at this shape the way that you do. And as a human, you're very good at this. You look at this shape and you go, oh, pink is clearly higher in the day. It's sort of sloping up a little bit more aggressively, maybe, sloping up a little earlier. The machine has no intuition for anything, so you have to help it see these patterns. And we do that by what we call featurizing these things. So we might make a feature which is, what's your average temperature during the day? We might make a feature which is, what's your average temperature at night? We might make a feature which is, how early do you start that ramp back up to sleep? We might add features, like each of those can be described within the day or across days as an average, but we expect they vary day to day. So maybe that variability is important. Maybe we would say, what's the variability of how hot are you during the day? What's the variability of how hot are you at night? So already now we've imagined, sort of cartooned out 6 features together. Each of those will have some statistics to it. Each of those will change over time. We can imagine many more. And in fact, in my lab, what we tend to do is say, those are a kind of feature called an explainable feature because they're derived by us. They're not made up by the machine through some series of transformations that we can't see. They make sense. They have some physiological meaning. But there might be lots of them that have physiological meaning, and we tend to use between 50 and 100 features in our larger algorithms. All of them are explainable, all of them make some sense, but they capture different kinds of change or different times of day, different kinds of shape, different kinds of wiggle. Now, I might take any two of those. I might say, well, here's how hot you get at night, here's how hot you get during the day. And I could make a graph and I could look at the regression of those two across time. Do they show a stable relationship? When one gets hotter, does the other get hotter, vice versa? I could add a third, and I could have a 3D graph, and it's a little harder to look at, but I could spin it around on my computer, I could look at it. Once we get past 3 dimensions, we really don't have a good way of looking at these data. And that's, again, where these emergence of large machine learning models, large AI models, become extremely helpful because the computer has no problem looking at all of these dimensions at once. And so we can say, here's 75 features. Each one is its own dimension. Across all of them, in interesting combinations, there's probably relationships that do a better job of telling me who's like whom, whose day was more similar to who, who's stably or changing in a way similar to whom. I can't see all of those relationships myself as a human, but I can mathematically describe the kind of relationship I want and get the computer to project through all of those different dimensions, all of those different features, down to sort of a shadow of that very nebulous data space, back into the 2D where I can see it. And I'm not going to try to show you very complex versions of that. I want to show you a simple cartoon so that you can get the concept of it. What are these machines seeing that we can see also? So we might imagine that we can place an individual person on an individual day, and there they are. And we go, okay, you're a point in space. What the axes are really doesn't matter. It's some mathematical construction of all these different features. It doesn't matter. It gives us a relative position. And what we're going to care about is how similar am I to myself over time, or do other people like me? So here's this other person. Well, they're pretty similar. Here's this other person, and well, they're a little less similar. They're farther away. Begs the question, how do we know how far is too far? How do we know what's a reasonable distance? And we get this from context. So we can look at, in our case, tens of thousands of people over millions of nights. And we can start to say, okay, there's, in fact, because of all of these features, all of these numbers, we have what's called a numerical landscape. So we're looking down on this kind of like a map of Yosemite if we wanted to go camping. And we're saying, okay, there's some dense parts, those maybe are mountains. There's some sparse parts, maybe those are oceans around our island. What we want to know is who lives where on this island that we've created. And as I walk through my journey of life, where am I? Am I walking towards an area that's associated with good outcomes? Or am I walking towards an area associated with the emergence of dementia, for example? So let's think about that. We've got this pink group, we've got this blue group. We can numerically say who's closest to pink and who's closest to blue. And we can say, before we do that, let's divide this landscape up by what we already know. We know some of these people on paper are older than, in this case, 70 years old. So we can segregate the demographic category, in this case, age, and we know where that older part of the landscape segregates in this case. We can then overlay that, and we can say, well, some of those people who are in that older population are definitely looking very similar to this pink group. So we can cluster them computationally, and we can say those people look pretty pink. Similarly, at the other end of the island, here's all these people that are much younger. And sure enough, when we ask the computer to place them in the map, it goes, no, they're pretty close to that blue part. Everybody else maybe is somewhere in between. They're not quite blue, they're not quite pink, but we can see as they age, their progression across this landscape. And again, the idea here is that if every point is an individual and a day, as you accumulate days, you can start to stack up, where am I relative to other people? Who am I similar to? Am I similar to people that have had medical conditions that I should worry about, like sleep disruption that is maybe an early risk sign of the emergence of Alzheimer's and related dementias? What we also want to do, though, is not just think about the extremely long term, because as I said, this demographic shift is happening within the next 25 years. That's much faster than watching an entire lifetime. So what we want to do is maybe go back to this map and just dust off everybody who's too young to be very interesting for this analysis. Let's just focus on those people that are older than 70 in this case. What we can do is we can take a very similar numerical approach, and we can say some of these people, by virtue of these many features that we've identified, are going to be more similar to each other. Some are going to be more different. Without knowing what that looks like, without knowing who those groups are, would it be possible to have the computer help us sort these people into clusters, types of people, phenotypes, if you like? And can we then go backwards and associate those phenotypes with, for example, the emergence of naps, so that we know what's the shape of change that's going to tell us the most about the risk of napping and potentially the emergence of dementias from them. So we might have a couple of clusters pretty close to each other, right in the middle. And we go, okay, those look pretty good. Maybe that's where most people are aging, and maybe that's a good, healthy baseline. Then we might have a small minority off on a small island to the side, and we say, okay, they look a little different. Let's see what's in there. Let's see what we compare it to. And maybe on the other side, we have a different island. And that different island maybe has different risks. And we could tell if somebody's varying. Are they leaning green? Are they leaning blue? Do we worry about things associated with red or things associated with gold as we look down the line? So we did this, and I can show you how these clusters shake out from these temperature data. So these are the real data now, and this is looking across thousands of individuals within our cohort older than 70. And in this case, we're only looking at individuals that had 200 nights of sleep within our record. So very well represented, very robust representations. And what we found was that there were 4 dominant archetypes or phenotypes of sleep and temperature rhythm across these people. So once again, we're looking at skin temperature here. And you might notice that now everybody looks like they're centered at 0 degrees. That sounds very cold. Really what we're looking at is change. So we're no longer thinking about how many degrees are you. We've normalized everybody so that their average is 0. And instead, we look at the relative change as a function of the time of day. So everybody gets hotter during the night when they're sleeping. Everybody gets cooler into the day. This allows us to compare these groups against each other and say, okay, they all are on average at 0. What is it about the shapes that are telling us a story that are different, that are separating these groups? One thing that you might notice is that a lot of these groups look relatively flat across the day. If we focus on this green and blue group, for example, thinking of the middle of our cartoon cluster over on the left, you can see that they have that nice little wave of a nap, and that looks very much like what we saw earlier. But they have a dip afterwards, and the end of the day and the start of the day are actually quite similar. So they wake up, they regulate their temperature quite well, they have a bit of a nap-like hump on average, but they're still doing a pretty good job regulating their day. We see that this red cluster has a little bit more pronounced hump, but it looks different. It's shifted over a little bit, and they're sleeping quite late. You see that temperature rise of red is far to the right. So this doesn't look like sleep fracturing. This looks like maybe these are people having a large lunch in retirement and enjoying their retirement. It's something different. By contrast, when we focus on this gold group, we see something that's a little more worrying. We see that their temperature regulation is a little bit loose. It gets overshot in the morning, they get too cold, and then the whole day is spent rising. When we think about this idea that the temperature rise is associated with the need physiologically for sleep, this looks very worrying. This looks like people that are feeling a lot of sleep pressure all day long. They really don't recover from that nap. It just keeps going up. So this is the kind of thing where these data can help us identify individuals in that gold group. And specifically, as they move from that green group into that gold group, that gives us an early detection of maybe your sleep is being disrupted. We can then take those data and compare it to sleep data, either with, in this case, the same device, or in the future by targeting interventions and saying something looks wrong. Let's track your sleep. Let's confirm that. Let's make sure. So if we compare this to when are people likely to sleep during the day, like we saw earlier, once again, we see that there's a substantial difference here, that in red, they're doing very well. In blue and green, they're napping a little bit more. Consistent with what we've said, that green group is a little bit hotter than that blue group during the day, and they do nap a little bit more. But the gold group is napping substantially more than all of them. And so this apparent sleep pressure coming from temperature really is doing a reasonable job of giving us a very, very early screening sign that something is happening with these people's sleep. notice that the nighttime temperatures still look on average similar. So this is an example of where these screening technologies enable us to leverage what we're seeing to drive resource allocation. We could target these people because of the computer's ability to recognize this shape and say, let's dig into the sleep. Let's ask them to get a sleep tracker. Let's see, are they fracturing? And the intention, again, is to say, because we can see not just that these shapes exist, but we can actually watch individuals day by day and score them on their similarity to these different shapes. We can create live tracking systems like the weather radar, where you can say, is a front moving in? Am I, in my journey, wandering into that yellow peninsula in my aging journey? And can I do an intervention and watch myself wander out of it? These things are technically now totally possible. And so it's the implementation of these in the world that is really the remaining challenge. So I'm going to pivot and end on a note about how do we think about putting these things in the world. My hope is that this idea of getting to watch yourself move across these numerical health landscapes is exciting. This was not possible with the more sparse data that we had historically, but as we all generate more data trails just ambiently because of the things we do in our lives, it becomes extremely possible, extremely fast, and that's exactly what we need to get ahead of this silver tsunami perceived burden. So you have this idea of a numerical landscape, and we can follow ourselves and say, ooh, I'm heading into that dangerous area. Let me change my diet. Let me change my sleep. Let me seek help. Let me learn how to affect my own behavior and hopefully change that course. As we start to put these things into the world, there's a few things that also need to change, not just the technology. So one thing is that only those people generating data have access to this kind of a learning, and only by comparing those people who have generated data do clinicians and researchers like myself have the ability to say, okay, for people like you, this is a good trajectory, this is a bad trajectory. Things differ by sex, they differ by age, they differ by ethnicity, they differ by where did you grow up, they differ by socioeconomic status. So it's very important to seek out and engage different communities. And it's very participatory. It revolves around people not only generating these data, but sharing them in such a way that they can be compared to others to allow us to make these comparisons. That also means there's some safety concerns. One of the things that will make this kind of technology really efficacious in the world is that it's safe and empowering. To the extent that you just have to trust, this app that I have to pay money for told me something, a lot of people, I think, reasonably will choose not to trust that, will choose not to share their data. And we will all be impoverished for that. We will all suffer for not having as good of a numerical landscape as we could have had if we'd included these other groups so that we could really more thoroughly understand the differences across people and differences across communities, and make sure that every community is really getting the most precise targeting, the most precise insights tailored to their particular community needs. That means there's a lot of social work to do. We need to figure out how to be safe. We need to figure out how to implement regulations that allow audits, that allow people to know who's using their data, when is it being used effectively, which data are changing over time. All of these things are becoming really important social needs, not just sort of neat apps. And so there needs to be more social engagement to determine what is going to be a standard for safety in this way. And finally, there's a nice sort of end note here where, as a lot of people age, one of the things that becomes important, at least through my experience talking to people, is that they really want to share what's happened in their life. This is a new way to empower that sort of sharing. The more that people adopt these technologies, get involved in these conversations about community involvement, about safety, the more these stories are really captured in data. They're not lost because somebody didn't hear the words coming out of your mouth. The data are archived, the data are safe, they're available to other researchers perhaps. And so you're able to share your life experience. Hey, I went on this diet, it had this effect on me. Other people that are physiologically like you, that can be clustered like you based on these data, can see these things, can learn from each other. So this is really a revolution in medicine. Instead of just saying, what does the doctor think? These technologies really enable us to be in a position where we say, as a community, what do we think? What are we learning about ourselves? And how do we find the clinicians that are especially interested in our needs, in our community? This provides a new relationship that's richer on both sides. Doctors can engage with very informed patients. They can understand the differences between these different communities that they're serving, and they can feel more effective using the resources they have, targeting those that are most in need. So there's a very positive potential here. Technically, all of these things are already possible. And again, the challenge is largely going to be showing that they're feasible, showing that they're safe, engaging different communities, and finding ways to do that as a large super community within the US and across the world.